Hi, this is Dan Praz, live from Underground Radio Network with part 3 of the healthcare agenda. I've read the entire healthcare law. I'm a CEO. I understand contract language, and words really do mean things, especially in this kind of law. The wording is very important on what's going to happen. And so I took a look at a lot of spots in the actual HR 3590, and that's the Patient Affordable Health Care crazy act that they forced on us. And I just want to tell you that a lot of it is just a giant spending bill. There's nothing more than spending after spending, 75 different categories of spending. But one of the things that really struck me, and I'll tell you the page numbers, you don't have to take my word for it. I have it up on the website. It's debtorsrebellion.com. You can go to the website and take a look at the bill, and while you look at this video and listen to me, you can read the actual contents I'm saying. This is on page 21 of 3590, unlimited spending. Unlimited spending. Now, what's really funny is it says this is for collecting health insurance consumer information. Now, let me quote it. It says, such sums as may be necessary. Unlimited spending. And it's in this bill a lot of times. It's on page 467, pain care, whatever sums may be necessary. There's not even an amount on page 467 for this pain care training or whatever they're doing. Whatever sums may be necessary. This is unlimited spending by the federal government. And in 3590, page 499, they have $125 million for training plus such sums as may be necessary. Unlimited spending in the bill. Now, let me go back to one of the ones I just talked about here. And this is for health insurance consumer information. This is really interesting. They have $30 million for the first year for health insurance consumer information. Now, if you listen to part 2 that I said, this is about getting me, the guy who pays for private insurance for my company, getting me out of that and getting me into an exchange. So they want to know all about me. If the government of the United States is not taking this over, then why do they want to spend $30 million this year to find about health insurance consumer information about me? Interesting, isn't it? But as you go through it, at the very end, it says, after the first year of the $30 million, it's any sums that may be necessary to carry out this part. Any sums that may be necessary to get information about me. Okay, really interesting. Let's go to another segment. Now, what's going to happen is really simple. You have your private insurance and you have these exchanges. And of course, their goal is to first raise my rates so bad that I have to go into an exchange. And once I'm in the exchanges are run by the federal government. That's simple. The people who don't have insurance, they will go to the exchange. They're trapped. They're in there already. Government controls that. But there are all these people who are really sick who would be turned down for insurance right now. Now listen to this. They're not going to go into an exchange. They go into this thing called a risk pool. And here's the risk pool, and this is on page 47. $5 billion a year. That sounds like a lot of money, but hear me out. For the risk pool, okay? Now, this is for high-risk people who wouldn't fit anywhere else in the plan. They can't put them in the pot because the pot's going to be a minimum base health insurance package. So they're going to put them in this risk pool. And it's $5 billion. If you think about it, you get 10,000 people with cancer, and they need massive treatment. That $5 billion is going to go out the window super quick. These are all the high-risk people. Now, let me read this to you. Just like I said about before, for the $30 million for the health insurance consumer information, this $5 billion does have limits, and this is what's really shocking. So what happens when the $5 billion runs out and people are still sick and still need care? Well, it says it. It says the government shall make, I'm quoting, shall make adjustments as are necessary to eliminate such deficit. My friends, that's a death panel. It's not a risk pool, it's a death pool. You put all these sick people in a pool and you give them $5 billion, and when their coverage runs out, what are you going to do with them? You're going to let them die. Where they're going to spend unlimited money on other things in this bill, and I gave you the exact clauses, the exact pages, and look it up yourself. Such sums may be necessary. Well, if you're really sick and you really need coverage, it's not some sums that may be necessary. It's the government will make necessary to eliminate such deficit. Eliminate. Good choice of words. It's a death panel.